Today, the world is confronting a public health emergency unlike any we've seen in over a century. We are facing a highly transmissible and deadly virus which not only claims lives but also disrupts the very foundations of our society. The American healthcare system is being taxed to the limit. Our economy is spiraling downward, and our population is being paralyzed by fear stemming from a lack of a coordinated response and a dearth of accurate, clear communication about the path forward. Our window of opportunity is closing. If we fail to improve our response now, based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. We have the world's greatest scientists. Let us lead. Let us speak without fear of retribution. Initially, our nation was not as prepared as we should have been, as we could have been. Some scientists raised early warning signals that were overlooked, and pages from our pandemic playbook were ignored by some in leadership. There will be plenty of time to look back to assess what has happened so we can improve. But right now, we need to focus on getting things right going forward.
Was there a failure to take immediate action when you correctly pushed to acquire additional doses of the drug remdesivir?
There was no action taken on the urgency to come up with a plan for acquisition of limited doses of remdesivir, nor to distribute those limited doses of remdesivir once we had the scientific data to support their use for people infected with this virus.
And instead of acting on your recommendations, was the response of others to try and cut you out of key meetings, marginalize your participation?
I was told that my urgings were causing a commotion, and I was removed from those meetings.
Can you tell us where we are now in the hunt for a vaccine and where we could have been had the HHS leaders made investment decisions sooner that were based on scientific merit?
Right now, there are over 100 different approaches for developing a vaccine for this coronavirus. So we're confident that hopefully, I should say, at least one of those or two of those will work, but you've identified key critical challenges that we need to anticipate and prepare for early. Number one is the supply chain for those vaccines, needed reagents and buffers and salts and the various ingredients that go into a vaccine, as well as the glass vials that the vaccines are put into, and needles and syringes, and then a carefully coordinated distribution and administration strategy. We haven't yet gotten to those downstream strategies yet in our government, and I think those are going to become a significant issue down the road if we don't plan for that now.
You know, I've been very critical of administration in terms of their, I call it incompetence with the supply chain, with lack of testing. I'm afraid the same thing's going to happen with vaccines and and the distribution. I mean, should I be concerned based on your experience?
Absolutely, sir. We're already seeing those challenges with limited doses of remdesivir, with data that we're getting that remdesivir has some benefit in people. And we have limited doses, and we haven't scaled up production, and we don't have a plan on how to fairly and equitably distribute that drug. If you can imagine this scenario this fall or winter, or maybe even early next spring when vaccine becomes available, there's no one company that can produce enough for our country or for the world. It's going to be limited supplies. We need to have a strategy and plan in place now to make sure that we can not only fill that vaccine, make it, distribute it, but administer it in a fair and equitable plan.
And that's not the case at this point.
We don't have that yet, and it is a significant concern.
Thank you.
I am sure there are specific conversations, emails, moments in time that you remember like they happened yesterday. The inflection points where if the response to your warnings had been heeded, things might have been different. And I'm sure they haunt you and keep you up at night. From January of this year, tell me about just one specific moment when you had that sinking feeling in the pit of your stomach because you were not seeing the response that you knew needed to happen.
Congressman, I'll never forget the emails I received from Mike Bowen and indicating that our mask supply or N95 respirator supply was completely decimated. And he said, we're in deep shit. The world is, and we need to act. And I pushed that forward to the highest levels I could in HHS and got no response. From that moment, I knew that we were going to have a crisis for our healthcare workers because we were not taking action. We were already behind the ball. That was our last window of opportunity to turn on that production to save the lives of those healthcare workers, and we didn't act.